Ladies, the next time your husband says he didn't hear you when you call his name, he may be telling the truth. More than 28 million Americans have some type of hearing impairment, and approximately 60% of them are men. Health experts believe environmental factors may be the major reason why, mostly due to noisy, male-dominated occupations such as construction and factory work. Another factor may be the use of some common pain relievers. In a study published in the American Journal of Medicine, researchers found that regular use of aspirin, acetaminophen, and non-steroidal anti-inflammatory drugs increase the risk of hearing loss in adult men. Think you might be at risk? The audiology specialist at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explained the symptoms of hearing loss.
Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. Symptoms of damage to the hearing nerve are tinnitus and hearing loss, and the two of them usually go together. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing.
Age-related hearing loss, you'll start to feel like you just have a muffled sound quality. Typically people say, it sounds like I have cotton in my ears, and they think they have wax in their ears or something like that because it just sounds muffled. And then you'll just start to notice the signs of not enjoying conversations, that type of thing. You just come in for a baseline, we'll see where you're at, and then we can give you recommendations from there.
One of the first things that we start to see are family members, significant others will start to notice that you're missing out on conversation. And they will usually begin to suggest that. And sometimes that's taken very easily, sometimes it's not. So it's a little bit of a touchy subject, but we do recommend that people come in just to have a screening. And we will be honest and let you know if you're in the area where we need to start considering amplification or not. And sometimes when we tell you what you're missing and help you understand that you're not completely deaf, there's not a huge problem, but we also understand why you're missing out a little bit, then it breaks the ice a little bit better.
A lot of times it's a family member that sends the patient in, but if the patient's, honest with themselves, they'll notice that when they're in a group setting, they start to not include themselves in the conversations because they're not quite hearing everything and they don't want to be embarrassed by answering incorrectly. So they just kind of withdraw from the conversation. We always tell people, just stop and look at your surroundings. How often am I having to ask people to repeat themselves, or how often am I not hearing it so I don't answer? Those are kind of the signs that maybe you need to start getting a hearing test so we can see where you're at.
For appointments and more information on hearing aids and the audiology services available at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Hearing Help for Men story link on our homepage at yourhometownhealth.com.